Back to the coronavirus in our Health Watch. While there are no confirmed cases yet, Africa is bracing itself for the arrival of the coronavirus. The WHO says the continent is at high risk. An investigation by the Associated Press looked into preparations for the virus in Zambia, where a health worker is quoted as saying, "We're definitely not prepared." So joining us now is the co-author of that piece, AP journalist Dake Kang. Thanks for joining us, Dake. So what people may not know, but they should be aware of this, is that China has invested heavily in the continent of Africa. Many countries, there are many companies working in Africa. There are also charitable organizations in Africa. So there's definitely a strong link between China and the continent of Africa. What are, though, some of the weaknesses that make Africa more vulnerable to the spread of the coronavirus than, for example, Europe?
Yeah, for sure. As you mentioned, China does have a pretty big presence in Africa. It's been growing over the past couple of decades. There's a lot of Chinese-run mining interests in particular. For example, in Zambia, there's a big state-owned corporation that actually has operations in Zambia. And that state-owned corporation is actually headquartered in Wuhan, which is at the epicenter of this new viral outbreak, as we know. So there's been a lot of concerns about that. There's an estimated 1 million Chinese citizens now living and working in Africa. And, the other side of this equation is that Africa's health systems simply, are pretty weak. Just in terms of the kind of treatment it can provide patients, in terms of screening, in terms of detection. There's a lot of concern right now in a lot of African countries that their health systems, just aren't prepared if there happens to be a coronavirus outbreak.
Mm-hmm. So I know Africa has sort of its own CDC. It's independent of the American CDC, but clearly they work together on, issues like this. So what do we know about what steps have been taken so far and what steps can be taken to ward off a crisis?
Sure. So, the WHO has been sounding the alarm about Africa. As of yet, there haven't been any detected confirmed cases in Africa, along with South America. But one of the key weaknesses before was that they just didn't have the ability to test for the coronavirus. So, there were just two, just a couple of weeks ago, there were only 2 labs on the continent that were able to test for the virus. One was in Senegal and the other one was in South Africa. And, coming to Zambia, that means that if you want to test for this virus, if you want to confirm that, a feverish, coughing patient actually does have this virus, they had to send it, by plane. It would take, 2 or 3 days. It was, sometimes prohibitively expensive, and that's really a big hindrance. So one of the big steps they've taken in recent days is to actually, train and supply the kind of, the agent that's needed in order to test for this virus. And now the WHO says all 50 countries on the continent are prepared and are ready to test for this virus.
Keeping in mind the relationship that China has within the continent of Africa and stronger relationships with specific countries, is China helping in any way? And I know there's also, a lot of African students that live and study in China as well. I'm sure they want to come back home. So what do we know about that?
Yeah, sure. So first of all, in terms of the relationship, China certainly has strong relations with many countries in Africa. As mentioned, those economic ties are really important. And, based on my reporting, what we're finding is that, Chinese officials and Chinese companies are, notifying local health officials when they feel like there are, potential suspected cases, or there's Chinese citizens who have recently come back from China who are, having a fever. They actually halted a lot of these state-owned companies actually halted their workers from coming from China back to Africa. That being said, they're not necessarily notifying the public at large. So what's happening is it appears that health authorities, for example, in Zambia, are actually doing tests in conjunction with Chinese officials and Chinese companies, but not necessarily notifying the public. As for your second question about, the African students stuck in China, that's right. There's a lot of African students who actually study abroad in China. In recent years, China has really become a major hub for African students because of the strength of that economic relationship. And many of them are desperate to get out. Some of them have publicly pleaded with their respective home governments to, get flights back home. I believe Kenya, Uganda, and Zambia also. These are some of the countries whose students are clamoring to get back. But as of yet, it doesn't seem as though, these governments are planning to do so. And we're not entirely sure why that might be. It may be because of cost. It may be because, the Chinese government is kind of keen on, trying to make sure other countries don't cut ties with it, don't shut down travel links, don't stir up any kind of panic. That could be a potential factor too. We're not entirely sure.
All right. Dake Kang, thank you so much, Dake.